what? Name, where they're at, maybe date, who's the president. And that's pretty much recent. Remote, you're going to say, I'm going to give you 3 words, April. At the end of my examination, I want you to repeat those 3 words. Dog, cat, bird. Okay? And after you complete your assessment, the last thing you'll say is, can you please repeat the 3 words that I asked you to remember? Okay? What's the next thing?
Test upper and lower extremity muscle strength.
Okay, I'm going to need somebody to...
I'm right here.
Okay, so usually what I like to do, if the patient's in the bed, go ahead and sit down, April. You can usually do the grips. This is something that I normally do not do, but that's something you'll see done. What I like to do is have them pull me in, okay? So that way you can really get a good feel of what their strength is, okay? And then lower strength, I usually have them, if they're in the bed, they'll have the leg actually laid down, but I'm going to have her lift your leg, just lift that way, okay? And you can do that. Another thing I like to do is put my hands on the palms and have them press down like they're hitting the brake. You can see the difference between the strength, okay? What's the next thing?
Light pain and touch of extremities.
Okay, and I usually have a Q-tip, and I usually bring Q-tips for you guys. Usually you have your patient close their eyes, and you'll use the cotton part of the Q-tip and just kind of ask them where you're touching. Okay? Can you tell me where I'm touching, April? Here's your arm, your right arm.
Right arm.
Your forearm.
There you go, forearm.
Okay, and then maybe you'll use the sharp edge to touch their leg, and they'll let you know whether or not soft touch, or what's the other thing? Soft or light or painful. So the cotton swab will be light, and then the stick part will be more of a painful touch, okay?
Assess cerebellar function.
Okay, so this is, I'm going to have you follow my finger. So what you're going to do is you're going to touch your nose, and you're going to touch my finger, okay? So let's start. Go ahead, touch your nose, touch my finger. I'm going to be moving my finger, okay? Touch your nose, touch my finger. Touch your nose, touch my finger, okay? Okay, what's the next one?
Assess for pronator drift.
Okay, so this is testing weakness, and you'll see this done with stroke patients. Put your arms out, okay, and close your eyes, April. If they have any type of deficit, you'll see one arm going up and one going down, okay? And that's to test weakness. Okay.
Assess for tandem walk on heels and toes.
Okay, tandem walk is pretty much what they do when you're drunk, and they pull you over. Okay, and basically you're checking to see if they can walk straight. Okay, and the other one is what?
Heels and toes.
And you're going to ask them to do this, and your doctors will do this. If they do a thorough physical on you guys, this is what they'll have you do in the room. My doctor has me do this. Okay.
Knee bends.
Knee bends? Or hopping?
Knee
Knee
bends.
bends. So you just have them do this to make sure that they pretty much balance.
And hopping.
And the hopping on one foot. Who would you not have hop on one foot? Who said that? Was that Love that said that? No. Besides an amputee. The elderly. Because they're already... Okay, what's next? Longberg test. Okay, you're going to have... you want to stand up? Have them stand, close their eyes. Okay? And basically what you're trying to see if whether or not they'll start swaying, okay? It's usually for balance to see. The cerebral part of the brain. Sometimes you'll ask them to have their eyes open, and sometimes you'll ask them to have it closed, okay? So usually start off with having their eyes open, and then you'll ask them to have them closed. Sometimes you'll see them do it with their hands this way, or their hands out that way, okay? Or this way. And then you'll see whether or not they're swaying.
So you want us to ask?
I don't think your book asks you to do that, but sometimes you'll see it done that way. Sometimes I think the book just has you do this. And I don't know if somebody can open the page. I think it just has you stand in the side like this and have you close your eyes. Because some people will start swaying like this if they can't do the balance. questions, you guys? No? The one thing that I didn't do with the eye when you guys recorded me, Sabrina, was the 6 cardinal fields, I believe. And what you have to do is, go ahead and sit down, Nicole, is you're going to have the patient follow my finger, okay? And there's 6 areas. And this is what we're checking, what I spoke to you guys about the conjunctivate earlier, okay? Oh, and then there's crisscross. No, up and down, you guys. It's side to side, and then up, and you're always going back to the nose. So it's side to side and then crisscross, okay? And I think that was the very last one that I didn't do.
Okay.
Did you find that?